Hello, Ayushi?
Hello.
Yeah, can you switch on the video, please?
Hello, ma'am.
Yeah, hi. So I'll be giving a brief intro about you and about myself and about my world. Okay, then you can take up the session. Okay, from there onwards.
Yeah.
Yeah, good afternoon, everyone. This is Krishna Priya from MedWorld Expo, which is a global medical networking platform. As well, this platform connects manufacturers, distributors, hospitals, clinics, labs, and health care experts like Ayushi worldwide. So, today I'm delighted to welcome Dr. Ayushi Sharma, a skilled dental professional specializing in conservative dentistry and endodontics. Dr. Sharma earned her BDS from Punjab University, Chandigarh, and completed her MDS from Subhate Dental College, Meerut. Passionate about academics, she has actively participated in numerous national and state conferences, earning top honors, including first prize at the Indian Endodontic Society Conference in Aurangabad, and recognition as a top 6 finalist at the IACDE conference in Kolkata. So it's a great achievement and kudos to you. Dr. Sharma has also made significant research contributions with 6 publications in reputed international journals such as Curious and the Journal of Conservative Dentistry and Endodontics. With her strong academic foundation, clinical expertise, and dedication to advancing dental care, we are honored to have her with us today. Please join me in warmly welcoming Dr. Ayushi Sharma to this session.
Thank you
Over to
so
you,
much.
Ayushi.
Thank you so much, ma'am. Am I audible to you?
Yeah, you are audible.
Okay. Ma'am, I'm sharing my screen.
Sure.
Is it visible?
Yeah, it's visible, Ayushi.
A very pleasant afternoon to one and all joining us for this webinar. I hope that at the end of this session, you all walk away with something valuable and insightful regarding this topic. Without further ado, let's begin. When we talk about root canal treatments, many cases are a piece of cake to treat. However, there are few cases which can give nightmares to even the most experienced and trained endodontist. Let's observe few such case scenarios. The very first one being a patient reports to the OPD with the chief complaint of discoloration and sinus tract formation. It appears to be a simple case considering anterior tooth. However, upon radiographic examination, what we appreciate is a pulp canal obliteration, which is also referred to as calcific metamorphosis. Now, this is basically a condition in which the neurovascular bundle is damaged due to the trauma caused to the tooth, and there's a hard tissue deposition in the root canal. Now, its etiology is multifactorial, ranging from trauma like concussion, subluxations, apposition of secondary and tertiary dentine, long-term intake of medications like glucocorticoids, which further reduces the blood supply, causing oxygen and nutrient deprivation to the neurovascular bundle, and hence a hard tissue deposition. Several researchers and studies have reported that a tooth which is suffering from a trauma, the incidence of PCO is likelihood to increase by 22% in later stages. Now, why does it cause a questionable prognosis is because it can lead to gouging, perforation, and missed canals. The second complex case scenario that a clinician can face is dens invaginatus. It is basically a malformation in which there's infolding of dental papilla during tooth development. So basically what happens is that the enamel, it infolds into the dentine starting from the tip of the cusp and can extend deep into the root. Now these infoldings basically results in stagnation areas for the bacteria which can predispose the tooth to dental caries. Now, dens invaginatus has various forms as described by Ehlers, out of which type 2, type 3, and A and B are the most difficult to treat. This is because they have a false communication called pseudoforamen that is formed, which other than the main canal. So the questionable prognosis or the challenge that we face is that we do not know which one is the main canal, and there can be a periapical lesion in spite of tooth being vital. I would also like to emphasize here that both pulp canal obliteration and dense invaginators has been categorized as the highest difficulty cases by the American Association of Endodontists. The third difficult case scenario is retreatment through the crown or bridge. Ideally, a crown should be removed to carry out the retreatment. However, if we proceed through the crown, the difficulty a clinician can face is the post-endodontic restoration can misguide the burr. The angle of the crown is not in orientation with that of the tooth. We are unaware about the type of restoration that is present beneath the crown. It's a blind procedure and the drop is not felt during the access. Coming on to another difficult case is fiber post removal. So this is a case where a periapical lesion was present and there was a fiber post and we wanted to non-surgically treat it. So the difficulties that can occur are damage to the root structure, perforations, root canal transportation, unwanted removal of dentine, and gaining patency is difficult. So is there one solution to all the treatments that I have mentioned till now? All the procedures that we have mentioned are otherwise a blindfold procedure which can be treated with one of the most latest technology, which is also the topic of our webinar today, which is guided endodontics. So what is guided endodontics? It is also termed as targeted endodontic treatment and was termed by Crestel and Zender in 2016. It has two subparts, static and dynamic. So in static, what happens is that the CBCT scan is superimposed or merged with the optical scan using a designing software, following which a virtual drill path is designed, and subsequently using 3D printing, a template or a stent is fabricated. However, in dynamic navigation, it's a real-time interface wherein we use optical positioning devices which are controlled by specialized computerized interface. Now let's look at each of these parts in a greater detail. Talking about the static endodontics, these are the components of static endodontics. Now the basic workflow is, as discussed, a CBCT, its file format DICOM data is merged the file format of the surface scan, which is STL, using 3 to 6 reference points, following which a combined image is formed over which a virtual drill path is designed and endodontic guide is designed. And after 3D printing, a template is fabricated. Now, the very first component is CBCT. So CBCT is a 3D imaging technique which forms the foundation of 3D printing, and its file format is called as DICOM. The DICOM stands for Digital Imaging and Communication in Medicine. It is basically that file format which helps to handle, store, and transmit the information in medical imaging. It also reduces artifacts that are caused in CBCT. Now, the parameters that we should keep in mind while performing guided endodontics is the field of view should be small, that is 5 centimeters into 5 centimeters, so that there's higher definition. The voltage used should be 110 kVp and 3.3 milliamperes of current. The CBCT should be taken in higher definition and in open mouth technique, and the resolution should not exceed 200 microns. The next component is surface scan. So the data acquisition from the oral cavity can be done by two methods. That is the direct method, in which directly from the oral cavity the data is acquired, and extraoral or indirect method in which we scan the cast. So the file format of surface scan is called as STL. What does STL mean? It is Standard Triangle Language or Surface Tessellation Language. Tessellation stands for where the larger compartments are broken down into smaller ones, which are then read by the computer and reorganized into a morphology and a shape of a 3D object. It can be created with the help of intraoral scanner, extraoral scanner, or DICOM data file. Now, Coming on to the third component of the guided static endodontics is the endodontic guide. Here we can appreciate a meshwork, and after 3D printing, a biocompatible resin was used to form the endodontic guide. So a template is fabricated to guide the drill into a pre-planned position for localization and exploration of the root canal orifice. One of the distinguishing feature between the static and dynamic navigation is that these templates are exclusively used in case of static endodontics. Now, the endodontic guide can be categorized into various types. They can be on the basis of use non-surgical guide or surgical guide. Then they can be either tooth supported, mucosa supported, or bone supported. And on the basis of surgical, they can be non-guiding, template for drill position, template for pilot, and for trephination. Now, the endodontic guide designing follows 3 steps. The first is tracing the canal, then designing the virtual drill path, and then the sleeve selection. Now, talking about tracing the canal. The tooth is visualized in three angles, that is coronal, sagittal, and axial. Now the canal, it appears as a black radiolucency in the middle to axial. Now if the canal is not visible, then the law of centrality is followed, where the floor of the pulp chamber is known to be present at the center of the tooth at the level of cemento-enamel junction. The second step is the virtual drill path. Now the path should extend from the entrance point to the target point. Now the parameters that we should consider while designing the virtual drill path is the target point, which is the first visible part of the pulp canal space. The angle of the path, that the drill should stay in axis to the root, and if the incisal angle is causing interference, then we can change the angulation. And the third is the diameter of the drill, which is the blade diameter, which should be kept as small as possible for the easy insertion into the template, and the shank diameter, which should coincide with the sleeve size. Moving on to the third step, which is a sleeve selection. Now, the sleeves are used for the guidance of the drills. The templates can be divided into 2 with the help on the basis of with sleeve and sleeveless templates. So the templates in which there is sleeve is present, it is more accurate and it provides a dedicated path. The disadvantages are that it is costly, more as there's more lab cost, limited visibility, and it cannot be used in a limited intraocclusal space like posterior teeth. Then sleeveless template. Now these are open design. They are less costly. We do not require dedicated drills and burrs in these cases. And in case of posterior teeth also, we can use them. The disadvantages are that there is no dedicated path. They are less accurate. Now, templates with sleeve, the parameters that we should consider are the inner, outer, and diameter and the height of the sleeve. Now, this is the inner diameter of the sleeve, which should correspond to the diameter of the burr. Just a second. Sorry. Is it visible?
Yes, ma'am.
Is it visible?
Yes, it is visible.
The slide is not moving.
Okay. We can see your screen now. It is asking, it is showing about inner diameter.
Yes, but the slide is not moving. Just a second.
Instead of using the keyboard, you can use your mouse. There is an option right near on the downside, like you'll be having an arrows, backslide and next slide. Can you share once? I'll let you know how to do it.
Okay.
Yeah.
Just a second, sir. Is it visible, sir?
It's loading. Yeah, it is visible now.
Okay. Sorry for the interference.
Yeah.
Then we have the outer diameter, which should be 0.1 millimeter larger than the inner diameter for the stability. And the height of the sleeve recommended is 5 to 7 millimeters. The other parameters that we should consider is the offset, that is the alignment of the sleeve, which should be 0.15 millimeters as it affects the fit of the guide. The thickness should be around 3.5 millimeters, and an inspection window can also be given in order to provide extra coolant and also more visibility. Now, this is a case in sleeveless template wherein Torres et al. Recommended a sleeveless guided endodontic approach in case there was apical pathosis and calcification in tooth 1-5. So here in the CBCT, we can see the calcification, and the virtual drill part designed was around 10 millimeters. A sleeveless template was fabricated in which there were cylinders and 5 occlusal rails, and then the drill was placed. Coming on to the next component of static, that is designing software, which, as mentioned, is used to merge the DICOM file with the STL, and the software that is exclusively used for the guided endodontics is Guided Endo. The other softwares are Code Diagnostics, 2ignis, and Acetion. All these are used for both implantology and endodontics. The other component is 3D printing, which is the additive manufacturing process in which the template is fabricated with the incremental deposition of the material. It is of various types. The first one is SLA, in which the UV laser is inserted onto the photosensitive resin, and the curing starts from the bottom of the layer. The second is the FDM, in which the molten material is used from the filamentous nozzle. And the other one is the polyjet, in which the resin is sprayed in very thin layers. The last but not the least component is the guided endodontic burrs and drills. Now, these are the Straumann drills, SS White endo burrs. Also, Mueller burrs can be used, which have long shanks and long length. Now, here we are going to look at few clinical applications of static guided endodontics. The first one is in the case of complex scenario of calcified teeth. So patient report to the outpatient department of conservative dentistry with discoloration with respect to 2-1. And here we can appreciate apical pathosis and pulp canal obliteration, and also an attempt was made to negotiate the canal. Then the Guided Endo was used to merge both the CBCT and surface scans with the help of the reference points. And then a virtual drill path, a virtual guide path was planned. Following which, an endodontic guide was designed and the drill was placed. This is the canal which has been negotiated successfully, and this is the working length radiograph. The second is the case of selective endodontic retreatment in posterior teeth. So here we can appreciate apical pathosis and calcification in the palatal canal of 1-7. Now both the scans were merged, following which a virtual drill path was designed, and a stent was placed, and the canal was negotiated. Now, in case of limited intraocclusal space, as mentioned before, we can either use open or the sleeveless endodontic guides. We can angulate the drill, and we can either use short drills. The next is in the case of the dense invaginatus. So here is the preoperative clinical image where we can appreciate apical pathosis and open apex and dense invaginatus with respect to 1-2 and 2-2. This is the CBCT view. Now, a virtual drill path was designed with respect to both the teeth. The stent was fabricated and was placed, and the drilling was performed. Now, this is the approach of static guided in retreatment of a separated intracanal file. This is my own case. And here we can appreciate that there was a broken instrument with respect to 2-1 and discoloration was a temporary crown. Then after the merging of both the scans, a template was fabricated and a virtual drill path was designed, after which we can appreciate the broken instrument retrieval. Now, all the procedures that we have seen till now were non-surgical endodontics. Now, this is a case of static guided in surgical endodontics. So here we can see apical pathosis and an unsatisfactory RCT with respect to 1-5. Now, since the root apex was very in vicinity with the lining of the sinus, so a surgical approach was performed. So virtual copy of drill was designed, and the template was checked for the fit and the incision was made. After that, the template for the osteotomy and root resection was checked and it was performed. This is the clinical aspect of the ultra-conservative guided osteotomy and root resection. And this is the clinical aspect after the placement of bone graft and the suture placement and 6-month follow-up. Now, according to Connor T. et al., it was concluded that guided endodontics was much more good in finding or locating the calcified canals, and there was less substance loss with guided endodontics in terms of traditional endodontic access preparation. And also it was not much influenced by the operator's experience. The advantages of this technique is that there are less iatrogenic error and better accuracy. The disadvantage is that it can be used only in cases of straight line geometry. If there's a lot of curvature in the root, we cannot perform it. And it can initiate dentinal cracks, and it is difficult to use it in the posterior teeth. And also the lab charges are high due to the fabrication of the stent. Now, the potential mishaps that can occur during the guided endodontics is the inaccurate drill position and unstable guide. This completes us with the static approach, and now we start with the dynamic navigation system. Now, the dynamic navigation system has been very rightly compared by Dr. David Burgess to the global positioning system installed in our automobiles. Just like we enter the destination into the GPS system and a path appears on the screen, similarly, as soon as we enter the target point into the Navident software, it guides us to the target point. It's a real-time interface. That is, we can change the path at any point of time. Now, these are the applications which are identical to static, like it can be used in the treatment of calcified canals, post-space preparation, retreatment in case of dense invaginators, and surgical endodontics. These are the various components of dynamic navigation system. Let's look at them one by one. Starting with CBCT. All the other components of CBCT is similar to that with the static. However, in static, we were using 3 to 6 reference points to merge both the scans. But in dynamic navigation, the older version of Navident, we used natural or fiducial markers. So what are fiducial markers? These are basically artificial as well as radio opaque materials that are either placed on the teeth or on the mucosa or are inserted into the bone, so as to merge or to register the patient's jaw position to the CBCT scan. Now, these fiducial markers are used if the patient is edentulous or has less number of teeth. If the patient has teeth, then natural anatomical landmarks can be used. The second is the tracking array or tags. So this is the handpiece attachment. Here we can appreciate the barcodes present here. Now this barcode is basically read by the optical positioning sensors, and this helps us to know the exact position of the burr in all the direction, that is x-axis, y-axis and z-axis. Then this is the jaw attachment, in which the black and the white pattern are read by the optical positioning device, and they help us to track the exact position of the patient's jaw. Now, this is tracer tool. Now, in the newer version of Nevident, we do not require fiducial markers. Rather, this tool can be used and 3 to 6 reference points to register the patient's scan to a patient's jaw to the CBCT scan. Then we have the calibration tool, which helps to determine the drill tip position and location in relation to the optical tracking tag that is installed in the handpiece. Now, this is the software or the system that we were talking about, Nevident, which is easy to use, accurate, and a portable system. Here, the advantage of the latest version is, that is 2.1, is that no fiducial markers are required. We can work with small volume CBCT, and new calibration tool is the part of this software. So this is the whole system where we can see the LED light box. These are the tracking sensors, the laptop in which the software is installed, and this is the cart assembly. Now, this is the software in which Nevident software, we can appreciate the crosshair reticule. This helps us to align the position of the drill concentrically, that is in X and Y axis with the target. And this is the depth gauge. So handpiece depth is monitored and indicated by the green bar. As soon as we are within the 1 mm of the desired depth, this color of green changes to yellow. And when we finally reach the target point, it changes to red. The basic steps in dynamic navigation is plan, trace, and place. That is, first we are going to plan the position of the implant placement or drill placement with the help of CBCT. Then we are going to trace the patient's jaw position or the tooth position to the CBCT scan with the help of tracer tool. And with the help of the Nevident software, we are going to place the drill or into the target position. Now, this is a case report in which the dynamic navigation was used in endodontic retreatment involving fiber post removal. So we can appreciate a diagnostic IOP where there is apical pathosis and fiber post and a zirconia bridge. Now, the planning was done with the help of CBCT, and a tracer tool was used to register the patient's jaw position. Then the calibration was performed and the drill was placed into the target point, and this is the post-op view. Now, according to Jen SD et al., dynamic navigation caused much less substance loss in locating simulated anterior root canals as compared to freehand excess preparation. And according to Dianet O et al., while locating the calcified canals, dynamic navigation successfully located 96.6% as compared to 83.3% in freehand. There were less procedural mishaps noted with dynamic navigation, and the mean time was also less. Then this is a case report by Gamberini G et al., where in case of endodontic microsurgery, dynamic navigation outperformed the traditional method by a wide margin. The advantages of this navigation is that it does not require dedicated burrs or drills. The 3D printed guides are not required. Multiple drill path can be planned as well as executed. At any point of time, the path can be changed. The lab cost is reduced and there's better isolation. The disadvantages includes it is a heavy and cumbersome apparatus. Then there's more digital waste. Then it is a sensitive procedure. Also, there is a learning curve associated with it. Now, I would also like to emphasize here that the field of guided is not only limited to endodontics. It has its tributaries to other branches as well. Now, guided endodontics has found its origin from guided implantology. So here's one of the case in which a static approach was used for the implant placement. So this is a preoperative OPG where we can appreciate missing 1, 4, 2, 5, 3, 6, 3, 7, and 4, 6, 4, 7. Then with the help of CAD-CAM, this stent was fabricated and then it was placed in the mouth. This is the post-op OPG. The second is in the biopsy technique. So This was a case report by Weldek S. et al., where we can appreciate this gray is the CBCT scan, and this yellow is the surface scan, and orange is the endodontic guide which has been designed. This is the tooth-supported drilling template. And then a semi-lunar incision and a full thickness flap. A semi-lunar incision was made and a full thickness flap was raised. The trephine bore was used to drill the biopsy, and then the suture were placed. The advantages of guided biopsy technique is that it is more precise, more predictable. It can be used in cases where there's deep-seated locations like the tongue, and shorter duration for surgical intervention. Then in case of pedodontics, so this is a case report by Krug R et al., where guided endodontic treatment of multiple teeth with dentine dysplasia was performed. Now, in case of Ehlers-Danlos syndrome, dentine dysplasia, the pulp canal obliteration is quite common. So this is a clinical picture and the OPG of the patient. And then the planning of a virtual drill path was done and the stent was placed. And this is the post-op view, a 1 year post-op view after the successful endodontic treatment. I would also like to mention here one of the cross-sectional study or survey that I pursued during my post-graduation, where we wanted to find out about the knowledge, attitude, and practice of guided dentistry among the dental personnel of North India. And we could found that because of the expensive nature and the difficult or the technical dexterity, this was cited as one of the major causes of not being used in the clinical practice. And academic lectures and dental workshops were the major source of information about this concept. I would like to conclude by saying that guided endodontics has its numerous applications in the field of endodontics, and it prevents various iatrogenic errors. Also, it is an expeditious technique and preserves the tooth structure, and with more time and innovation, and by cutting down the cost, we can make it more affordable treatment modality for both dentist as well as patient. And along with artificial intelligence, guided endodontics can rapidly evolve in the diagnosis and treatment planning. Thank you everyone for your patience listening. If you have any query, you can ask me or send your mail and on the mail ID mentioned. Thank you.
Ma'am, we have few questions in the chat box.
Yes.
We'll go with the questions first.
Yes.
So Venkat is asking what exactly is the guided endodontics and how does it differ from conventional endodontics approaches?
So guided endodontic is a procedure in which we can pre-plan the treatment with the help of the CBCT scan, digital dentistry, and then pursue the treatment. So here we use either templates or the dynamic navigation as mentioned. And how is it better than the traditional method is that since it is pre-planned, it is more precise, it is more accurate.
And we have another question from Meera Nair. Hello, doctor. How does guided endodontics improve accuracy in locating calcified or complex canals?
So, pulp canal obliteration is one of the most difficult cases to perform by any clinician. So, what happens is that with the help of the CBCT scan, we are able to design the virtual drill path, and then we can reach with the help of the dedicated burrs and drills to the target point and can explore those calcified canals.
And we have a question from Kumar. How does the learning curve for guided endodontics compare to traditional endodontics?
So, yes, the learning curve for guided dentistry is a cumbersome procedure. It's a difficult thing to do. But once learned, it does not depend upon the experience of the operator. Since it is already designed, it is already planned procedure.
And we have a question from Akshay. In which cases is guided endodontics most beneficial? Primary treatments, retreatments, or trauma cases?
So basically in cases of retreatments and in cases of trauma where there's obliteration or in case of surgical endodontics as well.
And we have another question from one Zoom user. Cost of single tooth endodontics TT with guided endodontics for patients including lab charges, CBCT. It works for single appointment root canals too.
Okay, so when I performed my case, so the template, it charged me around 5,000. The lab charges were 5,000. And since it was a hospital setup, the CBCT scan was not much expensive. So it cost around 7 to 8K. So it is a costly procedure.
Okay. And we have a final question from Abhinaya. What material is used for fabrication of stent?
So biocompatible resins or 3D acrylic resins can be used for the fabrication of the stents or the templates.
Okay, ma'am. So that's all in the chat box. So we will close the questionnaire over. I have answered all the questions. And if you have any other questions, please drop the questions over here. By the time I'll be completing about the MedWorld Expo. Ma'am, thank you so much for your wonderful session. So before I close this session, I just wanted to showcase MedWorld Expo, how it can be beneficial for all of you as a doctor or as a medical students. So I'll be taking 2 minutes of my time and share my screen and I'll showcase you how it can be benefited. So I hope my screen is visible to everyone. Ma'am, can you just confirm if you can see my screen?
It's visible, sir.
Yeah. So thank you so much everyone for being patiently listening till last 40 minutes. And today I am Nikhil from MedWorld Expo. I will be sharing you how MedWorld can be benefited for all of you once you register. So MedWorld Expo is a global networking healthcare platform. We will help in all of the people who are into the manufacturing, distribution, and healthcare services like hospitals, doctors, laboratories, diagnostics, and n number of healthcare professionals. So let us go in the way where most of the people who joined in the session is medical students, practicing doctors, and well-known doctors. So let me showcase how it can be benefited for all of you in MedWorld Expo. First thing, you will be able to discover all the latest medical equipments in our platform, and we have a success story of almost 7,000 plus distributors and 6,000 plus manufacturers and 9,000 plus healthcare service providers like doctors, hospitals, diagnostics, and everyone. And we have almost 2 lakhs products in our platform so far. And let me come how can you be benefited in this platform. First thing, you will be able to discover all the new medical equipments, and next you will be able to browse different kind of webinars. As you can see, we have so many upcoming webinars in psychology, psychiatry, hematology, pediatric cardiology. So we have n number of specialties for upcoming webinars. So if you are interested, please do register for those upcoming webinars as well. And we have CME programs which we are coming up soon in the next month. Here, this is a credit based programs where as a doctor, it is very much important for all of you to take those credits and renew your licenses of your healthcare businesses or your doctor licenses. So if you are interested, please come back to MedWorld Expo and register for CME programs, which we are going to start it soon. And we have news and insights. As you're into healthcare industry, you must be aware of all the latest medical advancements and the technology which is going across the globe. So here is a platform where you will be always educated with all the latest news and trends. And we have MedWorld blog session. So as you are a medical student or a doctor or practicing doctor or a well-known doctor or any kind of healthcare services or healthcare professional, if you are, you can write any blog if you wanted to. You can ask your questions, or you can put your thoughts, or you can write any kind of thing that you wanted to ask for the healthcare related things. So here are so many blogs already written by well-known doctors. So if you are interested, even you can also write. If you haven't registered to MedWorld Expo, please do register from www.medworldexpo.com. You can directly register from here and log into account, and you can directly write a blog. After that, we have medical communities. Since you are into healthcare, you need a very good networking, right? So our platform is the right choice for you to source different kind of networking in different specialties. Or else, if you wanted to create your own community within your specialty, you can create your own community and invite people. So people will join your community globally. So it's not domestic, it's global. So people will join your community and you can interact with them and you can make your own network directly. And we have MedWorld journals and magazines where all the healthcare related and global medical related, globally you will be able to access different kind of medical and medical journals and magazines in our platform. And if you wanted to post any kind of your journals, you can directly post in our platform. That option also we are giving it for you. And the other option that we are giving is career advancement program. As you are like few of them are graduates and postgraduates, and if you're looking out to study abroad, so we will be giving an option for you where we will be showing you the pathway how you need to approach and where you have to need to start. So based on from selecting the specialty, selecting the country, so we'll be guiding you the complete pathway, how you need to start and how you need to travel to the abroad, and what specialty that you need to take. So that kind of activity that we are going to do it for you. And last but not least, we have job opportunity portal, where if you see outside in other platforms, it is completely related to all the other categories, but MedWorld is very like specialized in only healthcare. So if you're looking out for a job, or if you wanted to hire anybody, so MedWorld Expo is here for you. So it is completely specialized into healthcare. So you will be able to apply for the right job, and employers can able to hire right people in the right place. So this is all about the MedWorld Expo. If you have any queries, you can directly contact this number, and if you can write an email to this email. So thank you so much for being active participant today. And ma'am, before we close the session, if you wanted to give any closing statement, please do here.
It was a wonderful experience. Thank you
Thank you,
so
ma'am.
much, everyone, for the patience listening. And if you have any query, please feel free to contact.
Okay. Thank you so much, everyone. Thank you so much for insightful session, ma'am. Have a very good day. Thank you.